Good afternoon. After some days, isn't it? Welcome to 𝐻𝐿 Academy, reading live with me, 𝐉𝐮𝐧 𝐁𝐝. Hope you all missed me. Did you? No? I'm sure that we would never allow anyone to be missed because we keep on keeping you engaged, isn't it? So, welcome to another lively session with me, Monday. So, what are you all up to? How are you all doing? Tell me. Give me some insights. How was your Vishu? How was, you would have seen we have got some lovely scores that our students have got for us. That's all stunning news that we have. And I was so happy to see a lot of students who are very, very familiar. Those names are very familiar to me. So, yeah, welcome to another session, because every time when the students make to their dream, another century, isn't it? A minimum of century is what we expect every time when our students attend. So that is always, our students are always making sure that they're always there. Abhiraj and hi. So yes, so I want all of you to start telling yourself, I will also have my picture there, right in front of 𝐻𝐿 Academy, along with Neetu Madam, isn't it? So that should be your priority or your aim, your target. How many of you have kept your pictures ready to say that yes, I have made my picture ready and I will have that picture there in front? 𝐺𝐿 𝐁𝐝, good afternoon. 𝐿𝐿𝐲 𝐉𝐻𝐃𝐲, good afternoon. 𝐺𝐿𝐲 𝐉𝐻𝐃𝐲, good afternoon. Very nice to see a lot of known names as well as a mix of new names as well, but happy to see at least one icon next to your name. So if you have not yet liked our page, please do click the like button. If you have not yet subscribed to our channel, please do subscribe to our channel. If you have not yet clicked the follow button, please do click the follow button. Now, why all these? See, we never want you to miss any program that we're gonna schedule. Okay, when you are subscribing there, you would definitely get the intimation. That's it. So Christina Varghese, good afternoon. Shiny VS, good afternoon. Grishma Devasya, how am I? I'm doing excellent, miss. How about you? And all of you. Kujali, good afternoon. Kavita Balaji, good afternoon. Very nice. So much happy to see the support that you are rendering. That means, the icon next to your name shows that how much of utter support you are giving to Neetu's family, isn't it? So, highly appreciated. I would definitely request all of you, if you feel my classes are beneficial, I want you to do me a small favor. Just share it on your social media platform. Why? Okay, because we say sharing is caring. And the other important thing is there are n number of students across the globe who are still unaware that we are doing such free classes. Because there are lots of constraints a student will have, isn't it? A student would always feel, lots of, I'm not demarcating the criteria. There are lots of constraints. So we want to make sure that the students are very nice. Sheila Shekhar, good afternoon. Shiny, thank you so much for that. My eyes just got onto your news. Thank you so much for your classes and guideline. I cleared the exam. Shiny, absolutely good enough. So happy to know that you have made your dream. I want you to let us know what is the score, or what are the scores that you have got, because that can act as a catalyst to all my students who is there in front of me. Sheila, how do I get reading material? See, Sheila, we share the reading material. We have few places where we share. The first and the foremost place where you get the reading material is the reading Telegram page. That's where you get the first hand information, and on the very same page that you're watching, we are posting, because reading Telegram page we only accept after scrutinizing, because there are a lot of fraudulent people, because it's an online platform. So in order to avoid them, we do have a scrutinizing policy. So after that scrutinizing policy, we will accept you into that reading Telegram page. Till then, we have few social media platforms where we share the very same page that you're watching is where you will get the material as well. So coming back to Shiny, please do let me know what are your scores. So Shiny, absolutely good enough. God bless you. And thank you so much for giving. See, it is your hard work, isn't it, for giving that small gesture. So fair enough. So I want all of you to be happy for Shiny as well, because we all are. When you are in our family, we all are happy for your great achievement. There I have another person coming and saying, Danya Vishwam, good afternoon. I cleared the exam. The life sections help me to improve my score. Thank you so much. Danya, very, very, very happy to know that you have also made to your dream. So I would definitely want you to tell us the scores as well, so that it can be an absolute morale booster to each one of my students. Shiny, reading 360, fair enough. Remaining modules cracked. It's absolutely good enough. Congratulations, Shiny. Very, very, very good. 360 is an absolute stunner. Good enough. Shiny, thank you so much. Thank you very much, Shiny, because I have to say thank you on behalf of Neeta's family, because you are the one who makes us proud. Good enough, good enough. Alan Maria Jomon, good afternoon. How am I? I'm doing good. Excellent. Thank you. How about all of you? Sanita Sabu, good afternoon. Prajita, good afternoon. Christina, take. Congratulations from Christina to both of you, Danya as well as Shiny. So it's how we all love to share those achievements of what you have got, isn't it? It's your hard work that have made to that dream. So congratulations to both of you, as what Christina said. Good enough. So yeah, more happy, because for a trainer, for an academy like us, we are very much happy when the students come. And Danya is saying, reading 370, listening 380, speaking 380, writing 410, absolutely hats off to you, miss, because I love a student who comes and says, I've made 410, 400 in writing. Is an absolute stunner, because for me, writing was always challenging. So, fair enough. Shiny, reading journey was 300 to 330 to 360. Absolutely excellent. It's a progressive way of journey. Good enough, good enough. And I would definitely tell you, Shiny, you are an absolute a person to always look forward, isn't it? Because you never bend down on your number of tests, isn't it? It doesn't matter. See, God have granted a date or a number of exams. Till that, it's an absolute, you should be, we say, when something goes wrong first time, there are a lot of people who will come and tell a lot of things. Second time also you don't, and you need that strength. The courage that you have is an absolute stunner. Keep it up, and now go and tell all those people who have told anything to you. Tell them, see, this is where I am in my dream country. That should be your final say. You will always have your final say, provided you practice well, you do in accordance to what has been told, pray well, you will get your result. So absolutely good enough. So thank you very much. I hope all of you are happy for Shiny and Danya. I know that you are. Likewise, you would definitely be coming and telling me in live, saying that I have made to my dream. Yes. Now next question. How many of you have kept your pictures ready? Let me see how many of you have kept your pictures ready. To say, yes, I'll have my name there in Neetu's family. I'm sure that all of you would. Right, now coming back to all these. See, now when Shiny said about that numbers, okay, now today I thought, suddenly I had another thing to say, but today I thought maybe that is more pivotal, isn't it? See, you always have to tell yourself, okay, it's not just one, it's not just number two, it's not just number three, it doesn't matter. So what you have to always, Angelina is saying congrats to both of you, take all these congratulations, Danya and Shiny, it is your day today, right? So you will have to tell yourself, it's not what others think, others tell, because I have gone through that, I know how it is. So you have to start telling yourself, it's what you feel about your effort. Okay, see, we have been talking about 8 minutes, we've been talking about 20 out of 20, we've been talking about 400 out of 500. Divya is saying congratulations to both of you. Very, very sweet of all of you. Josmin is saying good afternoon. Josmin, good afternoon. So you have to start telling. Every time you write an exam, okay, this is what is very, very important to each one of us. You should be telling yourself, see, I have done to the best of what I could. Okay, once you do that, the person above you will grant you. But whether you like it or not, there is a number. As soon as you have started your journey, no matter whatever the exam that you're doing, there is a number which is embedded that you can't change. Till that number, you will not get that until and unless that number arrives at you. That is one thing. See, people will come and tell you, there are a lot of things that I have gone through. I have my students who have told me a lot of things, which I'm not able to tell in a public platform. So, 𝐿𝐶, congratulations to both of you. Take that congratulations, Shiny and Danya. So, you have to start telling yourself, it's not what others will tell you, it's what you have to analyze. See, I have done this, okay, fair enough. Now, if I have recorrected, why did I do that? Because these recorrections and all those things are also very, very, very pivotal, because you have to always trust your gut feeling. That instinctive feeling is very, very, very important. Most of the time we take emotional decisions, that is an absolute havoc. So you are not supposed to do on the basis of emotional based decision. You are supposed to make instinctive decisions on the aspect of your gut feeling. Okay, because emotional feelings are always wrong. So you should not do that. Okay, so let's say 300. Okay, fair enough. Go and sit, analyze yourself. Where did I go wrong? Okay, I didn't attend this question. Why I didn't write? So that is a thing that I have done wrong, isn't it? Our job is to write all the 42 answers. You are not supposed to decide whether it is I'm only going to write the right answer or wrong answer. Whatever you feel, please do right. Understood? Second thing, did I recorrect some answers? Okay, now what is my proportion on recorrection? You should analyze yourself. Now, did I do the right way, the right strategy that has been taught to me? Oh no, I changed the strategy at the last moment because one of my friends told me a different strategy. No, that is for the friend's strategy. You have to stick to what, because it's not that day, it's how you reach that day. Clear? So that is how, because Shiny always reminds of me also, because every time you should know what is the significance of your hard work. The hard work will definitely reap you great benefits. That's the only way that you will get great benefits. There are fraudulent people who will message, I will give you that, I will give you this, come this, do that, this. Don't follow for these kind of people's trap. That's an absolute ruiner. They will simply ruin your money. Your financial stability, they will ruin you. So if anybody messages you, on the very same page that you're watching also, simply report them and block them. That's all what you can do. Safest. Okay? 𝐵𝐺𝐲, good afternoon. So I hope I was of some benefit to you. Now, without wasting your valuable time, we'll be going into part B and A. As always, the first thing that we will do is a part B. The question will be shared on the screen and I will be the one who will be monitoring the time, because we want you to have the same exam field. We want you to get exposed to, okay, this is the only time that we have. Reshma Sajeev, good afternoon. So the material will be coming up on the screen, and as soon as the material pops up, I will be the one who will be monitoring the time, and as soon as the time ends, I will tell you. Now the material is on the screen and your 2 minutes of time starts now. Right, that's the end of your time, isn't it? So in between, Christina said ready, Esther, good afternoon, Anne Teresa, good afternoon, Libby Peter, good afternoon. I hope all of you have got an answer, did you? Now please do let me know, did you all get an answer? Just put a thumbs up. Yes? On or before time? Time just goes very quickly. You have to always be in so quickly on the aspect, the whole perspective is, I'm trying to do it as on the aspect of, this is my exam material. Fair enough, I could see a few thumbs up. Now would you be kind enough to tell me what is your answer and where you got that answer from? Jilmi Dunn, Neetu Unnikrishnan, good afternoon. Now what is your answer? Not just the answer, I want you to tell me where you got that answer from. Reba Rijo, good afternoon. Fair enough. Now tell me what is your answer? Where you got that answer from. That where is very, very, very important. Esther, yes, fair enough, good enough. I love the way that when you respond, isn't it? When you respond, I am also more responsive. Mir Rizwan, B. Okay, I have Biji, C. Christina Varghese, B from the whole para. Okay, fair enough. Now I have the first, absolutely the way. Jilmi, B from the whole para. Fair enough. Shiva Simmu, C. Where did you get that C from? Is the question. Reshma Sajeev, B. Okay, fair enough. Shiva Simmu, hi, good afternoon. New name? And is there anybody who is attending the live for the very first time? Please do let me know where you're from, if it is. If it's okay with you. It's not mandatory, but I love to know where my students are from. Biji, C from the all para. Okay, fair enough. B from all para, C from all para. Grishma, B from middle. Okay, fair enough. So it's a competition between C and B, is it? Right. I know that not all of you have commented, but people who have commented, good enough, because you have come out of that. I'm from Sharjah. Nice. Shiva, thank you very much for letting me know that you're from Sharjah. Thank you. So Shiva is new, who's from Sharjah. Divya, B from middle. Okay, fair enough. So C whole para, B whole para, C, B from middle. Fair enough. Now, see why it is important that you start commenting. Angelina, B from full para. You have to always ensure that you have to start telling yourself what is the purpose that you are here for. What is your purpose? Why are you attending a live? Am I attending a live to enhance my learning ability? Am I attending the live to make sure that I'm corrected? I'm attending the live to say if I'm able to get the right answers. These are all things that you should be asking yourself. What is my purpose in attending a live? Is it just to find an answer? No. It is on the aspect of input, a lot of things. Now, back to square one, we'll be going and discussing part B. So part B, you'll have 6 questions, 3 answer options given, because there's only one type of question, multiple options with 3 options. Now what is the strategy? Now the material will be back on the screen, then we will do the analyzing of that question. Okay, which is the answer, whether it is B, C, or even it is A. Now, first and the foremost important thing that you should always remember is the strategy that you have to always remember. The strategy for doing part B is called elimination method. So, in order to do that, the first and the foremost important thing you will have to do 3 things. I will always say the 3 rules that you have to follow, abide by. First and the foremost important thing is read the question, underline the keywords on the question, understand the question. Very, very, very important. Okay, so what are the things that you have to, again, see the material have just vanished, isn't it? Don't worry, it's due to some technical glitch. It will be back on the screen, there you have. So read the question, underline the keywords on the question, understand the question. Very, very important. And these keywords, see, the student doesn't understand when the students have been forced. I force my students to do. 2 to 3 means 2 to 3, that is enough. The keywords are very pivotal. So see, for example, which of the following is not? That not is very important, because if you don't read that not, then for me reason, that is enough. Which, not reason, enough. Because the others I can understand. Engaging home care and all those things are Clearly understood. After this you have two options. If you want to read the paragraph and then you can pick an answer, please do. But I'm a person who want to know what I'm searching for in the paragraph, so I underline the keywords in the answer option as well. So specialized care, friendship, busy schedules. Now this is an important keyword, kin or next of kin. Okay, that's important. Now journal extract, the dark side of nursing homes. So something which is talking about the negative side. Now which of this is not the reason that not engaging in care home services? Why it doesn't? Now you have to read. Many people fear aging due to the loneliness that sometimes comes with age. People are prone to many diseases and mental health issues due to the decline in the immunity with advancement in age. So they're talking about why these people take, or illnesses like hypertension, dementia, Parkinson's disease, diabetes, arthritis and depression among others can sometimes be synonymous with old age. So it comes along. Okay, that's what they are meaning. As people age, their needs increase, yet at times their family are unable to manage their care. So what are they saying? Families are unable to manage their care. Busy schedule. So family, next to kin. Now this is an important keyword which you have to always, a person closest to living relative. That's what is next of kin. Okay. Now are they saying that it is due to busy schedule? No. They're not saying that it is because they are busy, they are not able to look after. They're saying the families are unable to manage their care. That means they cannot do anything. So for me, C is an eliminator as of now, but for me that is eliminated, okay, because it is just not because that they are busy, they cannot manage it. It's not because they're busy. Busy means because of their life schedule. No, it is not because of that, they are unable to do it. So many people resolve to take their aging parents to nursing homes where they can be cared for and in some cases receive treatment for a particular condition that they would not otherwise have access to. So what are they saying? For specialized care? No. Many people resolve to take their aging parent to nursing home where they can be cared because they know that they can be cared for and in some cases receive treatment for particular condition. See, that is for a particular condition. That is not just because, that is not the reason why they are. So they are saying that take them to that for giving specialized care. It is not the reason is the question. So a straight eliminator there. So two of the things are eliminated. So for me, B is the answer. Let's see, read again. Companion, their own age. There are more than 20,000 nursing homes for the elderly in the UK. Unfortunately, however, despite the help these institutions offers to families, there are many stories about mistreatment of the elderly behind closed doors. Patient report being neglected, beaten, secluded, and being treated in an undignified manner. So which of the following is not a reason for engage? That means you're going to engage with the care home service. So it is not for specialized care. No, eliminated. Busy, this is because they are busy to take care. No, eliminated. So the answer is for friendship. This is not the reason why you are going to get engaged. You are not going to have friends there. Understood? So this is a reason. This is also a reason. Our question is not a reason. Understood? So busy schedule, they are not able to manage. So that means it is not the reason. They are taking them to there. Understood? Now, for specialized care, yes, they can be taken to specialized care also. Understood? So, not a reason. This defines the question. Clear? So, the answer is they are not going to be taken not for a reason to get engaged in home care, it's not to make friends. Clear? So, the answer is B. So, congratulations for all the people who have got B. Most of you have got it. Angelina is happy. Good enough. Any doubts? Please do clarify. Any doubts? Anything that you want me to clarify or anything that you want me to explain a bit more? No. Kavita is happy. Fair enough. So that next to kin is a phrase, okay? You have to always remember it is your closest relative is what they are talking about, is it? Okay? Grishma is happy and dancing. Good enough. I love when people enjoy their achievement. Good enough. Any doubts? No doubts? Sure? Okay. I hope I was better for each time. Right. So we'll be looking into the next one. What is the next one? The next one is part A. We'll be doing part A. So what is today's part A material? Tell me. What is today's part A material? It's very easy, isn't it? It is Dupuytren's. I love that word. It sounds very cozy. Now, so the quest part A, the material is Dupuytren's contracture. Okay, I have told you the material. I want you to tell me how you felt about today's material and tell me how you felt about today's material and how many minutes you took to complete it. Tell me. Tijo, good afternoon. Easy, Grishma, I took 9 minutes, absolutely good enough, excellent. Very, very close to that 8 minutes barrier, isn't it? So the first student to tell me is it's an easy material, I took 9 minutes. Tijo, hi, good afternoon. So tell me, how about others? Tell me how you felt about today's material and how many minutes you took. It's about you actively participating, and see, it doesn't matter if you have taken 15 minutes, 20 minutes, it's not about, I told you. That's why I told you before I started the importance of validating. Why am I here for? I'm here to learn. Learning is a process where you make mistake, we rectify it, you rectify it. And that's how you learn. So yes, fair enough. Kureli, you're saying easy. I took 12 minutes, fair enough. So good, happy that you're all finding it easy. It's because of your absolute involvement in a routine called reading. Okay, good enough. So if you feel that you have felt it easy, it's because of your routine. Right, I'm not going to waste your valuable time because, as I mentioned, see, if a student respond to it, we have things to read because you're all there in front of me virtually. Okay, the only way that I could interact with you is with your valid feed. So yes, so the two students who have told me, they're saying it is easy, so I'll go into. So what are the things that you have to always remember? Few things. One, part A, you will only get 15 minutes. How many questions? 20 questions. These 20 questions are divided into 3 types of questions. So what is the strategy? Strategy is skimming and scanning. Scanning, which you are very much aware of. Detailed look. Skimming, quick look. So they say 1 to 2 minutes, but I always tell my students, you need only 15 seconds to skim through each text. That's where your target should be. 15 seconds each text, small text, isn't it? So what are the things that you have to remember when you are skimming? You have to always remember skimming, heading, subheading, letters given in bold letters, numbers, abbreviations, bullet form, proper noun. If it's a pictorial representation, the headings, that's it. So I'm just going to show you how to skim. See if you understand whatever and you are not expected to read word by word and all, okay? You're not expected to understand word by word meaning and all. Skim through it. So, text A, Dupuytren's contracture in the pulling of the fingers towards the palm. It's caused by the shortening and the thickening of the fascia and the fiber connective tissues and the palm and the base of the finger. This is thickened and forms lumps into the knot. That's the cord pulling towards the Dupuytren's contracture is a ring and the pinky finger, and right hand is affected twice and the left hand. So 80% of people have both hands. Eventually the condition makes a difference. Straighten the fingers in the picking of the shaking hands, and experts believe that inherited in most commonly in European and the more age of 40. It has affected women, younger adults and even children, but it tends to more severe when they start in early life. Done. Understood. So what do they understand? Okay, ring finger, pinky finger, one hand rather than the other. Very seldom you get European. What are the other things? Okay, shaking hands and all those things. It affects more women, all those things, but more severe in when it starts early. Done. So likewise, you should go through each text. Text B is about a study. So a cohort is mentioned. Text C is about treatment. So needle episiotomy, fasciotomy, all those things are there. Complications. So anything that relates to complication, go to D. This is how you should identify. You should differentiate. Okay, A is with this, B is this, C is this, D is this. Then you go to the question. As I mentioned, there are 3 types of question. You should know the question, numbers and instruction by heart. So 1 to 7, these type of questions are called match the following questions, where the instruction says you can write A, B, C or D. Okay, and you may use any of these letters more than once. Strategy doesn't change. You're going to underline the keywords, because part A, please understand, it's purely keyword referencing and synonyms language. All as what you have learned, synonymous language. They'll just change the word but the same meaning. Okay, now the general form of treatment. So treatment means where? Do you really need to really look into? No. Treatment we have done in a place called C, isn't it? But now because it's there, surgery is the most common treatment. Done. So C, if your skimming is proper, 1 to 7 is just 1 minute. When did Dupuytren contracture patients undergo surgery? Again, when means, so some period of time. So where are they talking about surgery and all those things? Where are they talking? When means a period of time. January 3rd, 2013 to June 20, Dupuytren was surgically treated. Done. B. When? Period. That's why WH questions are also important. Who? That means person. Are more prone to Dupuytren contracture. Where? Who means there are only mentioned where? In A. It can affect the women, younger adult or even children. Done. Or it is more common in European descent in men. Anywhere. They are only talking about A only. Likelihood of Dupuytren's recurring within a decade. A decade means, so you always have to remember this, decade and all is very, very prominent word in your exam paper. Decade means a period of 10 years. So likelihood, possibility, within, that means inside 10 years of time. So where are they talking about a time frame? Yes, 9.4 years. So recurrence is there. So straight, D. Understood how you refer? Clear? So a decade means 10 years. 9.4 is within that 10 years of time. Which anatomical region, that means a part of a body, experiences the most impact of Dupuytren's contracture? So where are they talking about? Definitely in A, isn't it? Which is more affected? It affects your ring and pinky finger. So you have to get used to these kind of things, and I'm sure that you would. Okay? Procedures performed on patients with bilateral disease. Bilateral disease means it is mentioned only in B. Why? Because when I underline bilateral disease is there. What are the procedures? Fasciotomy in both hands and all those things. So that is it. B. Post-surgical issues of Dupuytren's. Post-surgical. Where are they talking about all these post-surgical? So definitely complications. Complication of surgery. So post-surgical. Where are they talking about all these? So definitely during that, complications of surgery. Clear? Fair enough. So the answer is D. Now 8 to 14, the next set of questions, these are called short answer questions. So short answer questions, you have to always remember the instruction. The answer can be as simple as that of a word. Short phrase. Short phrase means now the answer can be anything between 2 to 3 words. That's called short phrase. Okay. words, a combination of words, a combination of numbers, or a combination of both number and words. So instruction, type of question, number should be by hearted. Strategy doesn't change, underline the keyword. To what minimum extent can the angle of contracture of the proximal intraphalangeal joint extend if it exacerbates disease severity? So where are they talking about these? Complications? First thing, is it under complication? Yes. Now degree, yes. Disease, particularly intraphalangeal joint contracture with 60 degrees. Abhirajan 7 out of 7, absolutely good enough. Keep it up. So minimum it should be 60 degree. So the answer is 60 degrees. Good enough. Now see, in which regions, now see, these kind of clues have to be noted all the time. Regions means singular, one or more than one. Are, plural or singular. Injuries, classified, intraoperative complication during surgery. So again they are talking about a lot of things. So complication is a very straight clue. Where? Go to D. Now what is the next thing? The most prominently affected part, isn't it? So they are saying intraoperative complications include nerve injury and arterial. So the answer is nerve and artery. Small thing, isn't it? Nerve and artery should be there because injuries and all are mentioned in the question. So artery is the nerve and artery. I like that word because Anu Thomas 7 out of 7. Excellent. Good enough, good enough. 60 degrees. Good enough. Nerve and arterial, no Anu, nerve and artery. Okay? So that's how you should differentiate. Sinju, Siju, good afternoon. So which surgical intervention? So again, where is surgical intervention? Treatment, is it? Yes, it is. So C, characterized by gentler nature, minimal healing time. So go to C. Where are they saying gentle, minimum healing time? Minimum means recovery is usually quick. Small means yes, mild contracture, everything is mentioned. So what is the? It is needle aponeurotomy. So NEEDLE aponeurotomy. Now which continent has a disproportionately higher prevalence of Dupuytren's contracture? So there is only one place, isn't it, where they are talking about? Now there is a glitch again, a small catch. The question is continent. So what is a continent? Europe. So the answer should be EUROPE. Okay, if you have written European also, I'm not saying it is wrong, but it's the most appropriate answer is Europe. Good enough. Now, which surgical methods entail small palm incisions to remove the problematic cord easing, finger straightening? So, surgical intervention means where? C. Now, small incision, cord, contracture, straighten finger. So, what is that? Fasciectomy. FASCIECTOMY. Question 13. What is the prevalence of bilateral disease among sufferers? Bilateral disease where? Is it in B? It is in B. Now bilateral. So what is the proportion? So where are they talking about the proportion of bilateral? So where are they talking about? Patients with bilateral disease, the number is 181. So it should be 181. Clear? Right. The next question. Which connective tissue layer undergoes thickening and shortening due to Dupuytren's contracture? So definitely A, isn't it? So where are they talking about? So they are saying it is caused by the shortening and thickening of fascia, the fibrous connective tissue. So what is the layer? It's called fascia. FASCIA. Understood how you got that answer? Fair enough. Now for the final set of questions. These are set of questions starting from 15 to 20. These are called fill in the blanks question, where the instruction remain as similar to that of short answer question. A word, short phrase, words, numbers, or both. All those things there. Now 15th question. Following a mean. See, this mean is again a very prominent word which always emphasizes the average. Okay. Follow-up period 9.4. Did we encounter this? This is how quickly you should see. Where did you encounter 9? Go to D. Patient experience Now see, again a clue has been pumped into. After the next word definitely would be a consonant sounded word, not an article, and it should be mostly it will be in its singular form, isn't it? Now Dupuytren's disease. So where are they talking about? Go to D now. So where are they saying? Occurred in some time and a mean of follow. So what is that? Recurrence. RECURRENCE is the answer. The out of patient. So patient definitely in B, isn't it? Underwent surgical treatment, only a mere dash underwent primary selective fasciotomy. So primary selective fasciotomy is the next keyword. So patient submitted to primary selective fasciotomy. How many? 247. So number 2, number 4, number 7 is the answer. Dash issue stemming, that means causing from Dupuytren's contracture surgery. Okay. Encompass. Encompass is another beautiful word which means includes. Urinary retention, left ventricle failure, myocardial infarction. So something which is there. So where? Go to D. It's due to a complication, isn't it? Myocardial infarction, left ventricle retention, everything is there. So which one is the problem? There are non-handed related complications. So NON-HAND-RELATED is a hyphenated word. Non-hand related complication, all these things. Clear? Question 18. In the end, Dupuytren contracture could impede full finger extension, hindering activities such as grasping objects or engaging in. So definitely the problems have been mentioned where in A. Because eventually in the end, the condition can make it difficult to fully straighten the affected finger due to picking up of objects. Yes, mentioned. The only thing which is missing is shaking hands. So the true word that is missing is shaking hands. 𝐻𝐻𝐴𝐾𝐼NGHANDS. Excellent. Due to inherent risk. So inherent means, okay, something which is there, okay, of risk or dash injury, needle aponeurotomy. So aponeurotomy, where aponeurotomy is there in here. So which one is the balanced ones? Yes, needle aponeurotomy. It is used to receive small incision. The doctor inserts a needle in the affected where the splint. The technique can be done in certain fingers. Risk of damaging nerve or tendon with needle. So all the other keywords are as such mentioned, isn't it? So nerve is there or tendon is performed with certain digits. Now this is another beautiful way of telling. See, digits, and especially in medical term, I know that you know it, but still, it was very curious for me. Why do you say digits there? So digits means one or several most distal part of the limbs. Okay, those are fingers. Clear? So fingers is being synonym. The way that it conveys is digit means fingers. Yeah, fair enough. So treating contracture entails breaking, cutting or dash that extract traction consequently, facilitating improved movement in the affected limb. So where are they going to talk about? Definitely during treatment, is it? Are they telling about? Yes, breaking is there, cutting is there, dissolving is there, cord is there, filler towards treat, contracture, improve movement, affected hand, all those things. What is that? Only thing which is missing? What is the only thing which is missing? Dissolving the cords. That's the only thing which is missing. Again, a 3-word answer. DISSOLVINGDTHECORDS. So I have wrapped my 20 answers. I have fired my 20 answers. If you have any doubts, please be kind enough to clarify. If not, do shoot. What are your total scores? I could see a lot of students like Subi non-handed. Subi was more active today. Sorry, Suja. CB. Non-hand related suja, shaking hands. Anutoma, shaking hands. Chinju, shaking hands. Suja, tendon. Chinju, tendon. Fair enough, fair enough. So happy that you are also making yourself more engaged with the. Abhirajan is the first one to tell me 19 out of 20. Absolutely good enough. Excellent. Keep it up, keep it up. How about others? Do shoot your total score. It doesn't matter, whatever it is. See, our job is to make sure that you are all growing on a daily basis. You're improving. So in order for us to know that you're improving, you should let us know where you are. 15, absolutely good enough, Angelina. Good enough, good enough. See, now go back and see where you have gone wrong. Isn't it? See, that's called the process of learning. It's not just saying 20 out of 20 out of nowhere. No, I have got 15. Now, where did I lose this? 5 marks. How did I? It can be a spelling mistake. It can be a hyphen you didn't put. There are n number of reasons. Because when a student is true to herself or himself, that's where that, the growth happens. Understood? We are here to grow. Good enough, but again, I have only 2 students who have told me what are the scores. Others haven't haven't given me the scores. But again, I always respect your privacy. You want, yes. If you don't want, no, that's okay, absolutely fair enough, as long as you are beneficial, yeah? So any doubts? I don't see anybody asking me any doubts also. Okay, so that means all of you are absolutely clear about what I've just told you. Kavita, 19 out of 20, excellent, absolutely good enough. This is how you should. Angelina, thank you. So Angelina, I've started saying thank you. So on behalf of Neetu's family, I'm here to say thank you very much for giving us another opportunity to come in front of you. Okay, until and unless I meet you all tomorrow. Adios from me. God bless you.